Los Angeles. Nearly 10 million people on their way home, to work, to a show. 10 million stories converging at a stoplight, at the restaurant, and on the freeway. In the suburbs of Downey and Panorama City, many of those stories will converge here, Kaiser Permanente, where the lives, skills, and education of caregivers and other professionals merge to give priority to one life, the next patient.
In early 2008, we had really been looking at how we were doing in terms of preventing all kinds of different healthcare-associated infections. And the research was really clear that the environment could be an ongoing source of potential infections. So we partnered with a physician, Phil Carling, in designing a program where we could do some cleaning validation.
Our management team, unbeknownst to the environmental services staff, will go select some rooms and we will mark with that fluorescent marking gel 14 frequently touched surfaces. When we did the baseline data, we're only cleaning 19% of our frequently high touch point surfaces.
Our baseline came at 28%. The toilet flush handle, it was a 0, meaning that it was never being wiped.
When the data came back, it was clear we did have an opportunity to improve.
We got this beautiful place, big hallways, private rooms, and the place looks clean. And then we hear from Enid, not so much. That's where I think the science that Enid and her profession brings in to the group really help us not rely on what we think, but then real hard data and give us something to work on that we can improve.
Our leadership, fortunately, was very, very supportive and recognized the potential opportunity to improve care. But we also have a real strong labor management partnership. And I met with the coalition of our labor union leaders, shared what we'd done, shared what the findings were, and then talked with them about the strategy for improving our cleaning, and that the work that we were going to do was not intended to be punitive or disciplinary in any way, but to help our staff learn.
Through the Regional and Environmental Services Peer Group for Kaiser Southern California, and working in collaboration with Infection Prevention and Control, competency validation tools were made. We standardized policies and procedures for cleaning. And we took that information as well as the process for applying the fluorescent marking gel. And we utilize pretty much those three things in working through our unit-based teams to retrain staff, to show them how the fluorescent marking gel process worked, and to make sure we were cleaning all the same way.
And I think one of the misunderstandings sometimes is that people don't have the best intent when they're performing their jobs. They really do, but they just need to know exactly what they need to do, which they understand early on during their training, but why they need to do it. And that's how you have an effective team.
We put in the context of really saving people's lives, that they had a unique contribution to make as members of the healthcare team that was critical.
Nursing and doctors can only do so much, but if we let the germs sit in the room, what's the point of doctors and nurses doing their thing?
In 2009, first quarter, we saw our score go from 19% up to 80%. And then for 2010, we saw a sustained score of 90%. Now we're in the first quarter of 2012, and we're cleaning 97% of our frequently high touch point surfaces in our patient rooms.
I was so impressed and proud of everyone. They embraced it. Right now we're in 98, and we've been 98 for the last 2 years. And not only in the patient areas, but also in the ORs, special procedure rooms, common areas. We started last year. We're actually doing very well on that too.
Healthcare is very hierarchical, and the key is to having everybody viewed as a team member for what they bring to the party.
It's like they said, united we stand, divided we fall. And now that we're all on the same page, I mean, there's no stopping us.